Hi, my name is Nicholas Small. I'm a public health registrar for the Central Queensland Public Health Unit. I've been working in this role for over 18 months, ever since the beginning of the COVID-19 pandemic. So what is unique about public health compared to other specialties is that you have a very different patient population. So instead of managing an individual patient, you manage a population as a whole. And the people you engage with at times are patients themselves when you're looking at notifiable conditions, but often you're engaging with the health system, health ministers, politicians, and other scientists from other areas. Because there's three key roles that a public health physician plays, and that's coordination, communication, and education. So the advantages of training regionally in this pathway is that you get a wide breadth of exposure. So in 1 minute, you're meeting and presenting to hospital executives, meeting the board of directors, and the next minute you're climbing the ladder of a boat to swab the crew of a cargo ship that has suspected COVID on board. So the training regionally gives you a wide breadth of experience, both in policy, as well as communicable diseases, as well as non-communicable diseases. So much to do for someone such as myself. So I'm a kite surfer, I'm a surfer, and so I get to do a lot of that kind of activity on weekends and when spare time allows. This particular public health unit is very research oriented, so I get to experience and work in research in several capacities. And in particular, I also really dislike traffic, and so I get no traffic on the way to work. I don't have trouble finding a parking space. There's plenty of activities to do. I can go camping on the weekends. I got cafes, you got bars, and you got some of the most beautiful beaches, the Keppel Islands, just at my doorstep. So other than the normal entry requirements, which are 3 years of medical training including your internship, and a master's in public health, there's no other specific requirements. My thoughts is really you'd have to have love and appreciation of big picture medicine. So by that I mean policy, the effects of the environment on human health, health protection, in my case epidemiology and biostatistics, and the appreciation for working with the health system as a whole. So at this stage, we are now in the second year of the COVID-19 pandemic, and there's probably few specialties in such high demand as public health. There's a critical workforce shortage. However, to get a training position can be very competitive, as there are only a limited number of accredited positions out there nowadays. So while there's plenty of work to be done in public health, the specialty training positions remain competitive as ever, as it's important to get the right training, the right training job, and that's accredited. To become a public health physician, you will need to apply for fellowship with the Royal Australasian College of Physicians, the Australasian Faculty of Public Health Medicine, which is known as RACP, AFPHM, or as we know it colloquially, AFM. Fellowship involves completion of the 3-year full-time equivalent advanced training in public health medicine program, which consists of 36 months of core training. The entry requirements and prerequisites include general medical registration with the Medical Board of Australia, be a citizen of Australia and New Zealand or a permanent resident of Australia, 3 years postgraduate medical experience, secured employment in an appropriate advanced training position, and completion of a Master of Public Health or equivalent that satisfies the 5 Australasian Faculty of Public Health Medicine compulsory core discipline areas. These discipline areas are epidemiology, biostatistics, health protection, health promotion, and health policy planning or management. The application and selection process. Queensland Health provides a centralised recruitment process through the Queensland Public Health Advanced Training Program. Funded full-time positions are advertised only when available by the Resident Medical Officer or RMO campaign and managed by the Metro North Public Health Unit. Priorities given to existing Queensland Health Public Health registrars in good standing who are continuing their training. Registrars will be required to negotiate their placements with supervisors within the Queensland Health Accredited Training Network under the guidance of their faculty-recognised mentor and gain approval from the Public Health Physician, Metro North Public Health Unit. The Queensland Public Health Advanced Training Program website provides further information on the key contacts and participating facilities where you may complete your training. In addition to this network recruitment, there are additional participating facilities and positions which are accredited to deliver training requirements and can be viewed on the RACP website. I really love living and working here in Yeppoon and Rockhampton, in particular this public health unit. So we get extraordinary breadth of experience, but also the research program that we have here and the research outputs that we do are of national significance. And we certainly compete with the metro units in terms of our research outputs.